Assalamualaikum doctors. In this video I am discussing a recall communication that is about gastrostomy tube. It is a consent scenario. So the task come like that. CP child did gastrostomy tube, we have decided, and there is an important special information in this communication, that is, do not forget stoma nurse. Okay, so we will mention stoma nurse. So how can we do that? As usual, we are starting with IRCAP. So I know that you are such a keen ma'am. I know you are doing such a great effort like taking care of your child. I know it is not easy to take care of a CP child, but you are doing your best and I really admire your effort. So you're giving some repo. Oh, thank you, doctor. I am here to take a consent from you to do a gastrostomy tube for suppose Ali, and at the end of the meeting I hope I take the consent from you. Okay. So first of all, what is it? We will draw pictures like that. I picture draw. So it is a tube from the skin outside to inside of the stomach through which we can feed him and give him medication. So it is a tube which is attached to the outside to inside of the stomach, and by which we give the feeding and the medication. So is it a surgery? Yes. It can be done either by open surgery or keyhole surgery. So what is keyhole surgery? So it is an endoscopic surgery. So why he need this tube? To be able to feed him and give him his medications. So is there any alternatives? NG tube. NGT will be alternative, but as you said that he is pulling it out. So these are you with me? Best option for Ali now. Oh, doctor. So what are the drawbacks? So we will mention the drawbacks. Drawbacks of sleeping medicine, first of all, then pain, bleeding and infections. Say the problem and the solutions. Also, there are temporary drawbacks. There is a risk of obstruction, but if this happen, first of all, you will do the massage of the tube between your fingers. If it did not work, you can get a 50 ml syringe and fill it with warm water and try to push and pull technique. If it did not work, you can use the carbonated water preparations. After that, if still not work, you should seek medical advice immediately. Are you with me? So there are lots of things. Painkiller we are giving for bleeding. There will be expert doctor. Infection we are doing on hygienic measure. These are sleeping medicine. The best doctor who are expert, who already done lots of time. The important is obstruction. Will explain that if obstruction occur, what happen? Will be massage the tube between two fingers. If it did not work, we will do 50 ml syringe with fill in warm water and try to push and pull technique. If it did not work, then give the some use carbonated water preparation. If still not work, then you have to seek the medical advice. Oh, okay, doctor. Also, there is a risk of dislodgement. If this happen, you will put NG tube in the opening, then go to the emergency room immediately. So if it is a dislodgement occurs, so put an NG tube here and go to the emergency room immediately. Am I clear so far? Yes, doctor. So it may be there is a risk of leaking, but we will use skin protection cream, and if still leaking, you should seek medical advice. So skin protection cream also we give. Are you with me? Yes, doctor. But I do not know anything about how to take care of gastrostomy tube. You will not leave this hospital till we have a meeting with a specialized nurse who teach you everything you should know about care of the gastrostomy tube. So how to feed him through this tube? So we have two types of feeding. Number one is continuous feeding and number two is bolus feeding. Continuous is by using an electrical pump allowing certain types of food to go in the stomach over a period of time. And bolus feeding by special syringe, you will put a semi-solid fluid and you will push it through the tube and then to the stomach. What about hydrotherapy? Once trauma is healed, he can do hydrotherapy, take shower and swimming. So hydrotherapy is that swimming and shower once the healing occur. How can I give him tablet through this tube? Tab we can give should crushed and dissolved in water, and after that can given to him. The summary, trusted website, leaflets and support group. So hope that you are agree with our plan of gastrostomy tube. So this is the communication. Thank you.